Hari Om. Hari Om. Now today's subject is yoga for asthma. Asthma is a problem of the lungs and connected with breathing. And we get oxygen through breathing. And it's a continuous process from birth to death. Because there is no storage of oxygen in our body. And we need oxygen at every instant. Every cell of our body survives with oxygen and functions with oxygen. And that is provided by the process of breathing. That's why breathing is very, very important. And in asthma, the breathing itself is somewhat difficult. That is why in one way we can say it's a serious disease also. At the beginning stage, it is not serious. And yoga can provide very good means for this. So while treating the asthma patients, we must find out what is the difficulty and what is the exact problem in the body. The breathing process definitely depends on function of lungs. For inhalation and exhalation, the muscles of the lungs, they are operating. And in asthma disease, the muscle strength becomes weak. Of course, this is one of the reasons. So while treating, we have to focus on that. We have to increase the strength of the muscles of the lungs. The different muscles take part. The muscles in the ribs, muscles of diaphragm, and of course the alveolus. Then one more reason is elasticity of the air tubes. Because the air is going to the lungs through the air tubes. Somewhere they are bigger, somewhere they are very, very thin. But air is passing through that. So these muscles of the air tubes, they are expanding and contracting for allowing the air to go in and out. And in certain cases, these muscles go in spasm. That means they cannot expand or contract. So their elasticity becomes less. And that is why the air intake and outgoing air is suffered. Then the stress, it may be physical and mental, or physical or mental. The stress have got very bad effect on the elasticity of the muscles also. Stress is mental, but mind is connected with every cell of our body. So these cells doesn't function properly because of the stress. And there is a mucus in bronchial tubes. There is air tubes. Now mucus is always there in healthy condition also. Because mucus is sticky. When we inhale air, it contains some particles. Impurities, of course. So these particles stick to the mucus because mucus is aligned in the air tubes, the bronchial tubes. So the fresh air enters in alveolus without any dust particle and all. That is why mucus present must be present there. Mucus must be present always. It is in healthy condition also. But in asthma cases, this mucus increases than required. So excess mucus, you can say. And excess mucus definitely reduces the cross-sectional area of the tube. is it gets aligned from the side. Normally it is aligned, but when it is excess, the cross-sectional area is reduced. So we can say blockage starts in the bronchial tubes. That is why also air intake and air going out is less. So these are the major reasons for the asthma, for the breathing problem. And so we have to focus, we have to select the yogic practices which may increase the strength of muscles, elasticity of tubes. You can reduce the mucus, of course, for which diet is required. So how you should overcome the asthma? First, very important and simple thing is reduce the excess of mucus. Because this mucus is created through the food only. Our food contains lot of good things and bad things also. So mucus is outcome of the improper food. So diet control is very, very essential. If the patient doesn't control the diet, then improvement is hardly possible. So we have to prescribe accordingly that he must control the diet. I will talk on that afterwards. Then removing excess mucus, cleansing practices are also very important. In our yoga, so many cleansing practices are there. These are definitely useful or very useful, I can say, for the patient of asthma. Then if you want to increase the strength of the respiratory organs, all of them, then pranayamas are very important. So pranayama also plays very important role in the treatment of asthma. Asanas, of course, but asanas are to be practiced in a particular way that I will discuss after some time. And meditation, of course. Then increasing the flexibility of the bronchial tubes. Asanas, pranayamas and cleansing practices, all of them are useful. And for reducing the stress and allergy reactions, Yoga Nidra is there, Om chanting is there, and meditation is there. So this is how we'll try to control the symptoms of patients and increase their capacity. So let us see how we can incorporate different yogic practices for this different. So we'll go to our training program now. Is it as a standard format is there? The preparatory practices, because the patients are quite new. They never practice yoga. So their joints and muscles are not ready for practicing asanas. So we can prepare the joints and muscles for the practice of asanas. So this is preparatory practices. Then there are selected useful asanas. I'll be discussing the details. And cleansing practices also very important. Pranayama, meditation, yoga nidra. And of course I will explain the contraindications also. And most important is food recommendation also. So let us discuss this point. Preparatory practices, you must start the program with Shavasana practice for minimum 3 minutes. It's a usual practice. Because in Shavasana, the person gets total relaxation. And we plan by our instructions of Shavasana, proper relaxation of the body and so to some extent mind. Then we can start the basic movements from Yoga Sopan books, hands, legs, knees, waist and all of them. So all the muscles and the joints become free, relax. Stress is removed from that. And total body is ready for practicing proper asanas. Then you can start the preparatory movements from Yoga Pravesh book. The preparatory movements are a little bit on advanced stage of basic movements, you can say. So we start gaining the muscle strength. In preparatory movements, we operate all of the body organs in a particular position. So definitely the muscle strength starts increasing with this. Sun salutation also helps for that, because sun salutation includes asanas, pranayamas, mantra chanting, everything. Or alternatively, we can use Pawan Muktasan series also from the book APMB, Swami Satyananda Saraswati's book. More or less all of them are similar, but they are explained in a particular fashion. So anything will be do. This is a preparatory practices. Now useful practices. I added preparatory movements again, type 1 to 10 with slow speed and sun salutation, because these are very important. Basic movements you may not continue because these are just a preparation. But these preparatory movements and sun salutations are useful for increasing the muscle strengths. So they must be included in useful practices. Then coming to the point of asanas, these are practiced on level 3 and 4 with so level 3 and 4 means attaining the asana position with very, very slow movement. Then relax the muscles. Yes, this is very important, of the body as well as much as possible. A very important stage in practicing asanas. If the muscles are not relaxed, the asanas will be of no use. They will have no effect. So you must focus on this relaxation of muscles while teaching all the asanas. Of course, for that they have to maintain the asana for some time, but that they can develop with slow speed, no problem. Then concentrate the mind on the lungs, so that we can provide the mental energy to the lungs, all different parts of the lungs. Mental energy we can provide by concentration. And then maintain the asana position for some time with this. That means particular asana, then all muscles to be relaxed, then mind to be concentrated on the lungs, and then this is to be maintained for a long time, as long as it is comfortable, of course. But this time we can increase step by step. Beginning it may be a very short period, maybe hardly half a minute, 1 minute or so. But after certain practice we can teach to maintain maybe 5 minutes, 6, 7, 8, 10 minutes also. But the important point is it must be maintained as long as it is comfortable. If there is overstretch or pain, it must be stopped immediately and asana must be released. And then of course release the asana position with very, very slow movements. So this is the practice of asanas on level 3 and 4. So all asanas are to be practiced on this level. Then let us come to the proper asanas. Asanas are very common in our regular practice also. Bhujangasana 1 minute, Shalabhasana only 15 seconds, Dhanurasana 30 seconds, Ardha Matsyendrasana 2 minutes on each side, Akarnadharunasana 1 minute on each side, Ustrasana 1 minute, Chakrasana, Trikonasana 1 minute on each side, Virasana 1 minute on each side, Shavasana when needed. So this timing is, we can say, minimum which the patient should attain to get the proper benefit of the asana. But this may not be possible on the first day. First day it may be hardly 5-10 seconds. And slowly we have to go on increasing time up to this. And this is minimum time for which every patient should maintain the asana. But after that, if somebody has got additional capacity, you can increase the time. If you increase the time, they will be more and more beneficial, definitely. But this is a minimum time benefits. Then cleansing practices. Agnisar, 100 strokes total in 3 to 4 rounds. Total may be 100 strokes. Each round may be 20, 25, 30 strokes, like that. In Udyan Bandha also 5 rounds, 30 seconds each. Kapalbhati also 5 rounds with 120 strokes per minute. Of course, this is a target. We have to start with slow speed and try to attain this target. Jalanati also is helpful because it removes the mucus in the nasal passage. You see, the mucus is produced in the lungs, particularly the bronchial tubes, and it moves upwards by itself, taking away the dust particles and all that, and it comes in the throat, and many times it passes through the food pipe and dispose of through the digestive tract. But when it comes in the throat, it may enter in the nasal passage also. It's a common thing. So generally, Jalanati will remove the excess mucus in the nasal passage. That is why it is also important. But I recommended once a week is sufficient. But Vamanadhavati alternate day is very, very important. Because as I told you just now, all that mucus is passing through the food pipe to the stomach. And it is accumulated in that. Normally it is removed through the remaining part of the digestive tract, small intestine, large intestine, and that. But Vamanadhavati removes it from the stomach itself. That is why it is very effective. And that is why I recommended alternate day. Of course, we have to observe the capacity of the patient. Initially, we may start once in a week also. And slowly we can increase the frequency. But it is very essential. In Laghu Shankha Prakshalan, short course, once a week is recommended. Because it cleans the digestive tract from mouth to anus. And Purna Shankha Prakshalan, full course of Shankha Prakshalan, once in 6 months. This is not to be repeated earlier. Because if it gets used to that, then that can increase the complications of the digestive tract. So once in 6 months is okay. But Laghu Shankha Prakshalan once in a week also we can practice. So cleansing practices are very, very important for asthma patients. But again, normal suggestion that we must study the case paper. If this asthma patient has got some more complications, then this program will vary. If the patient is pure asthma, no other problem, all other functions are perfectly in healthy condition, then I have prescribed this program. Suppose the asthma patient has got hypertension. Then most of these practices are not useful. Particularly Jalanati, Vamanadhavati, Shankha Prakshalan, we use salt water. That is harmful for the hypertension. Then Agnisar, Udyan Bandha, Kapalabhati also not advisable for hypertension. So that depends on the state of hypertension. If it is perfectly controlled, then we can practice Agnisar, Udyan, Kapalabhati. But definitely Jalanati, Vamanadhavati we can't. But asanas we can practice. If the person is having some heart problem, then it is very difficult to treat. In such cases, we have to treat him for heart disease first. If he improves, then we can increase some of the practices from asthma, otherwise no. So like that we have to consider. So this is very important aspect, because what I am prescribing is for a pure asthma case. Let us come to the pranayam. Anulom Vilom, deep breathing, 15 minutes. Very easy and anybody can practice. Proportion which is convenient and suitable for an individual person. Then Ujjayi Pranayam without Kumbhak for 10 minutes. Because some researches, it has been found that Ujjayi Pranayam is very useful for removing the mucus. And that is why it is important. Then right nostril Purak followed by Brahmari Rechak, 21 rounds. As fully and deeply possible to a particular person. Then Nadi Shodhan Pranayam with Kumbhak, 15 minutes. Of course, with Kumbhak means you have to teach all three bandhas, Jalandhar Bandha, Uddan Bandha, Mool Bandha. Before that, you have to teach all these Anulam, Vilom and all that. So it is very step by step. It may take a longer time. You cannot teach with Kumbhak first time, initially only. Similarly, Bhasrika Pranayam also with Kumbhak, 10 minutes. Brahmari Pranayam, it may be without Kumbhak for 60 minutes. So I have given a lot of time for that. The patient must have that much time. Otherwise, you can reduce it. That is up to you and patient. You can reduce the timing and start with very short period. Slowly go on increasing as much as the person can do. Again, these are prescribed for a pure asthma patient. If patient has got some complications, then many pranayamas are not useful. Kumbhaka is also not useful. That you have to decide with the individual case. But all these pranayamas, these are stimulating pranayamas. That means in Ayurvedic terminology, it is increasing the heat. You can say stimulation of all organs, and which is needed for asthma. That is a right nostril breathing, Bhasrika, all these are recommended for that particular case. Meditation, you can recommend Anahata Chakra meditation with the mantra Om Yam. Anahata Chakra is connected with heart and lungs because it's just behind the heart. So it is nearby heart and lungs. So Anahata Chakra is controlling all the functions of the heart and lungs. So you can provide mental energy to Anahata Chakra, which will further stimulate the proper functioning of lungs. Then Yoga Nidra, as I said in the beginning only, because for overcoming the stress and removing the mental blocks. Specially designed Yoga Nidra for asthma is the best one. Otherwise, Yoga Nidra for stress relief will give some solution, no problem. But specially designed for asthma is, of course, better, which will work fast. Now, optional practices are many, you see. Because for asanas, there is no limitations. You can teach if the patient has got sufficient time, and if you have got the time, you can teach all these asanas. Viparit Karni, Vakrasan, Uttan Padasan, Pavan Muktasan, Sulabh Ushtrasan, Ardha Chakrasan, Marjarasan, Garudasan, Patangasan. You can add some more also. It depends on the capacity of the patient. Pranayamas also we can advise both nostril breathing, Brahmari Pranayam without Kumbhak. Cleansing practices also, Dandaneti, Dandadhavati, Vastradhavati, Navli. These are still useful, no doubt. Vastradhavati is the best one for asthma. But a normal person is not able to practice that Vastradhavati. Otherwise, that is also good for asthma patient. Because it removes the mucus. If you consider contraindications for asanas, there is no contraindication. Any asanas can be practiced, depending on the capacity of the patient. But pranayamas, yes, because asthma is a cold nature disease. So Shitali, Shitkari and left nostril breathing are to be strictly avoided. Otherwise, they will increase the state of asthma. So pranayamas, these contraindications you must remember always. Food suggestions are very important. As told in the beginning only. Because food components increase the mucus in our body. And increasing the mucus in the bronchial tubes is also one of the major cause for the asthma. So food control is very important. And of course, controlling the weight also is very important. Because if the weight is increased, it will take the load on asthma, lungs also. The lungs will fail to provide the proper oxygen in case of obesity. So that also we have to control. That is why we have to advise normal food with less fats and carbohydrates to reduce the fats in the body. But with high fibers, so fibers, they help us to clean the intestine. That is the best food is fruits, of course, except banana, guava, custard apple and cucumber. Because these fruits, banana, guava, custard apple and cucumber, they are in cold nature. So they increase the production of mucus. So they have to be strictly avoided. And of course, vegetables and warm food is also important. This warm food is very good, effective. No cold items, all hot food I can say rather. Because of the heat, the mucus becomes thin. And when it becomes thin, it is very difficult to remove out of the body. That is a hot condition. Food also must be hot, room temperature also little bit hot, not too hot. So this hot condition is best for these asthma patients. Now accordingly we can prepare the daily practice program, whatever I have suggested. This is a total program, but depending on the strength and physical condition of the patient, we have to select the proper thing, select the timing and all that, and accordingly you have to prepare a prescription for a particular person individually. Because normally all these patients have to be treated individually only. Everybody has got something different. So accordingly we have to modify the program for each and every person. So accordingly you can prepare the program and give it to the patient and let him continue the practice. First, for teaching, you may take 1 month or 2 months also. But the person should continue the practice afterwards. Because cure will take long time. It's not fast cure. A lot of development has to be done in the body, particularly for the lungs, which is not possible within a short period. So learning is okay. You can teach, patient can learn. But regular practice is very important. And with the regular practice, he can increase the timing and all that also. So he can achieve the proper targets after the regular practice, and that will give the very effective result. Now one more important thing, which is common for all patients, that the medicines. Asthma patient normally takes some medicines. Whatever is there, maybe some inhalers or some tablets, whatever it is. So let the medicines be continued. Because this yoga program will take some time to have some effect. Till that we can control the situation with the medicine. Because if the medicine is stopped, the patient will have difficulty in breathing, and that will increase more complications. So please do not stop the medicine of the patient. In any way, you are not allowed to stop legally and ethically also. So let the medicine should be continued. And you go on advising the patient to check intermittently. Physical checking. And consult with the physician. So the condition is improving, the physician will definitely go in reducing the medicine. And finally the medicine can be stopped also. But otherwise, means without yoga practice, medicine cannot be stopped. Rather it goes on increasing day by day. And patient becomes serious also. But with the yoga, the medicine is reducing step by step. And finally it will be stopped. And the patient will feel better. So that is how we have to control the asthma patients. So, Hari Om.